So there's various treatments, but basically there's two categories. One is to treat the inflammation and prevent the disease from progressing. And then there are treatments that are symptomatic. So they just reduce the inflammation, make the pain feel better, but they don't really treat the disease itself. So ideally I like to have my patients on the type that really control the disease and prevent it from progressing so you don't get the damage and the disability. But the only issue with that is a lot of them have to work on the immune system. So I mentioned to you it's an autoimmune disease, so it works by lowering your immune system. So unfortunately, that's the only problem is that you may be at slightly increased risk of having infections when you're on these medications. So some of these medicines you may have heard of. You might have seen commercials on TV for like biologic medicines like Enbrel, Humira. You see those kind of commercials. But we also have another drug, which is a pill called methotrexate, which is the commonest one. Do you have a question?
Several years ago, methotrexate was defunded or not paid for by several different drug companies and insurance policies. Has that been relieved or changed? Because they were saying because of methotrexate there was an increase in heart disease?
Actually, no, I mean, now drug companies will pay for it because it works so well in rheumatoid arthritis, so there's plenty of studies that back up that it works. So for that reason, they have to, because it's probably the cheapest drug you have out there to treat rheumatoid arthritis, so it's in their benefit to pay for it. So they do pay for it.
I know my health insurance line would not cover it.
Like several years ago.
Yeah.
Yeah, but now on the whole, they do cover it.
It has.
Yeah, because they've had studies that later have proven that it works.
Okay.
So this is why we give these treatments now, because we know that it works. We have studies that they've looked at like patients with rheumatoid arthritis and those treated with versus not on methotrexate, and it works. So they have to. So those are kind of the drugs. It's very complicated. We've got lots of drugs now on the market that work. And you have to kind of work with your rheumatologist because they'll know where. Usually we like to start with the ones with the least side effects and things like that, and then work up if we have to. But a lot of times, you will be on a medication for a while. Sometimes that stops working, and you have to go to another one. So, there's some. You really have to work with your rheumatologist on that part. Now, the symptomatic treatments are, medicines like prednisone, as I mentioned, which has side effects. Things like can cause osteoporosis, high blood sugars, weight gain. So we like to keep people on that for as little time as possible. But it is good short term. It makes you feel much better in most patients. So sometimes we do have to use that. And then there's all these other non-steroidal anti-inflammatories like ibuprofen, Celebrex. They work, but it's limited how much they can work, and plus they're not good for your stomach or for your heart. So you kind of don't want to take those on a long-term basis, for a long time, and to avoid this.